pain? Well, maybe you should stop drinking. Hi, I'm Rachel. Shoulder pain affects 1 in 3 people and places a significant burden on quality of life. On average, workers require 39 days off of work due to a shoulder injury. Currently, clinicians will use a bundle of interventions such as exercise, pain medication, and manual therapy to treat these people. This is known as multimodal care. It's expensive, and yet we don't really know if it works and helps people recover. Each year, hundreds of articles are published trying to determine what the best course of treatment for shoulder pain is. But what can clinicians and policymakers do with all this research? How do they know what to follow or what to believe? This is why systematic reviews are important. For my thesis, I conducted a systematic review trying to determine if multimodal care is an effective treatment for shoulder injuries. To do this, I searched 6 different databases and found 5,885 articles to go through. I read the titles and abstracts of each of these articles and then determined if they were relevant to my research question. I found 15 studies focused on multimodal care and shoulder injuries. From there, I then evaluated the methods of each of these studies to determine the amount of internal bias they had. 10 of the studies had a low risk of bias and therefore were included in my review. These 10 studies all focus on adults with either subacromial impingement syndrome or nonspecific shoulder pain. I calculated the effects of each of these treatments to determine if they were effective. For the majority of the studies, it shows that multimodal care is not effective, even when it's compared against placebo interventions or interventions that have been proven not to be effective. However, I did find a couple of studies that showed that multimodal care may help. The most interesting finding was that a program that included acupuncture with dietary advice to follow an anti-inflammatory diet, which includes reducing alcohol consumption and taking enzyme supplements, leads to greater recovery than a combination of exercise, manual, and soft tissue therapy. But before we all put down the bottles of wine and ruin your weekend plans, this program warrants further investigation. Since multimodal care is currently used in clinical settings, we need to develop programs that actually work. In order to do this, we first need to combine single interventions that have been proven to be effective and then test those programs. So until then, cheers everyone.